Hi everyone, it's Dominic from the MS Guide. Thanks for joining us. I'm joined by Emily Stock, and Emily is the main project lead at the MS Brain Health Initiative. Now, what is that? What does it mean and why it's important? We're just about to get into. Very quickly, if you do support me on Patreon, I'm super grateful. It's patreon.com/the MS Guide. Either way, just subscribe to this podcast or whatever it is, and it tells the algorithm that you like this kind of stuff, and that's good for me. But anyway, on with the show. Emily,
Thank you,
welcome.
Dominic. Thanks for the intro. It's great to be here and happy to speak with you today.
Excellent. I'm pretty sure many people know that my axe to grind is the fact that you do better with MS in the long term if you're treated effectively and early. Now, your strapline is hashtag time is brain. What made you guys go down this route? Can you tell us a bit
Yeah,
about it?
absolutely. So it's essential, as you said, to diagnose and treat MS as early as possible. And that's all about preventing irreversible disability progression and obviously to maximise lifelong brain health. So in MS, the immune system mistakenly attacks and damages tissue in the brain and also spinal cord. And although there are repair mechanisms that operate, they are often incomplete. So some of that nerve tissue is irreversibly destroyed, and that can lead to shrinking in brain volume over time. And obviously, in healthy adults as well, a small amount of brain shrinkage occurs with aging. But people with untreated MS, this happens at a faster rate, and therefore time really does matter in MS.
Hmm. Emily, you said a word there which I always find slightly alarming, and that's irreversible. So I've had MS 31 years, and the way I understand it, should we say the damage that's been done is not going to be undone? That's what you mean by irreversible,
Yeah,
isn't it?
yeah, absolutely. And obviously, that is the key reason why time matters in MS, that we need to catch and diagnose
Hmm.
and treat as soon as possible.
Hmm. I always think about it like rotting wood in some ways. If you spot the rot, you can treat it and you can cut it out and you can deal with whatever the cause of the rot is. And if you leave it ages and it spreads, your house is going to fall down.
Yeah, and as you say, there's also a lot of evidence that shows that intervening early leads to better outcomes for people, which is obviously the big thing here that we want to achieve.
Well, I think this is just okay. Here, maybe you can help me with something. What I don't understand, Emily, is if I'm sitting in front of a neurologist, let's say I'm you and I've just been diagnosed with MS and I'm a young woman and I'm sitting in front of the neurologist, I always struggle to understand why they aren't thinking, gosh, my job here is to ensure that Emily is as well as she can be in 20 years' time. Not, oh, let me just tick a box and sort of sling her on a drug and yeah, whatever. But actively thinking about Emily in 20 years' time. Do you want to have a family? Are you going to save money for your children to go to university? What sort of stuff do you do? What kind of
Mm.
job do you do? Do you want to travel the world? Whatever it is, but I never hear of these conversations happening.
Yeah, no, absolutely, Dominic, and actually that links with. I mean, our understanding as a community of MS has evolved really rapidly over the last few years. And actually, we now know that subtle disease worsening, so sort of small changes over time, can happen like right from the beginning of the disease. So even in the
Yeah.
early stages, things like cognition, your emotional well-being, quality of life, day-to-day activities, ability work to work can be impacted. So yeah, time really is brain.
Yeah, it's extraordinary. I'm not expecting you to sort of read the minds of neurologists because I know you're not one. But how somebody it's not unknown that this disease isn't so much a now thing, but it's a intervening now. Shall we say treating it like an acute thing, like a heart
Mm.
attack, which is a treat now to prevent real issues or death. But MS doesn't have that sort of urgency attached to it. How are you guys going about trying to attach this
Oh,
urgency?
that's a really great point. So, I mean, that's what started the MS Brain Health Initiative in the first place. And as you say, in other disease areas, we have that urgency is there. And in MS, back in 2015, before our report was published, that urgency really wasn't there. So our initiative is all about calling for policy changes to enable people with MS to live their best possible lives. And as you said, the strapline is called Time Matters in MS. That was the key recommendation of the report. So it was all about shouting about how we need to diagnose as soon as possible and treat and manage and care for people as early as possible.
So let's be clear for people. Policy is essentially, driven at government level.
Yeah, absolutely. And obviously, it has multiple stakeholders involved. So, in this
Yeah.
case, MS societies, obviously, people with MS themselves, um, all contribute, health economists as well as policymakers, all involved in making sure that we can drive change that actually helps people in the long run.
So if you were going to paint the ideal picture, what would it take? Would it be having a protocol like, say, for treating a heart attack? Or, what is it? So when the rubber hits the road and the patient lands in front of the neurologist and they said, Emily, I've got something very awkward to tell you, and it's a bit of a shock, but you've got MS, but don't worry, we've got you. But that's the key point of intervention, is when that person first gets a formal diagnosis. What does it mean? What's the aim of you guys, shall we say, to change what happens at that point?
Yeah, I mean, we're so obviously the report is 8 years old now. So what we're doing now is we're updating the report because
Sure.
obviously so much has changed in recent years. So we're at the kind of beginning of this process now, and we're discussing with multiple stakeholders, with people with MS, as well as healthcare professionals, on exactly at your question what this means. What should those recommendations be? What policy changes are needed in different countries to actually make sure that, like you said, people are able to be diagnosed quicker and treated more quickly as well. And obviously, in the intervening 8 years since the first report was published, there is more evidence, for example, into the fact that if you treat early with high efficacy disease modifying therapies, that can lead to better outcomes for people as well. So that evidence wasn't there back in 2015. So that will be one of the key aspects
Mm.
that we'll want to include, and that's just one of the aspects. And as I said, we're discussing with lots of people in the community at the moment as to what the recommendation should be.
So describe for me. I mean, you're not a doctor. I'm not a doctor, and I know you're not saying that this is the absolute thing. But when that conversation is had and the news is delivered, outline roughly the next steps that the MS Brain Health Initiative thinks should happen. Not Emily Stock, but the MS Brain Health Initiative. I'll just say that again. MS Brain Health Initiative
Yeah,
should happen. Is it a case of we should have a 2-week target to get you on a high efficacy medication, a bit like the Attack MS trials investigating? Or is it saying 4 weeks or 6 weeks or 1 week? I don't know.
yeah, so that needs to be agreed with the experts essentially. I mean, as part of the initiative, a few years back, we did a Delphi consensus process, which is essentially just like a big um, framework of doing different surveys to find out what people think about
Yeah.
basically what times are important here. So yeah, you're absolutely right. That will be one of the key discussions into the timings, and obviously the MS Brain Health Initiative is a global initiative as well. So um,
Uh-huh. Yeah. That's where saying it's not just the UK, because well, MS doesn't care where you live, does it?
Absolutely. And so, therefore, when we're talking about giving precise targets and timings, as an initiative, we try and take the approach that we often have. When we did the work before, we had three different what we call levels or standards for care,
Hmm.
depending on. So, and the idea for that is that whatever country you're in, you have something to aim for. No matter what your level
Yeah.
of resource is, for example. So the actual number that the experts might associate with that for different countries might be slightly different.
Okay, Emily, I guess what hacks me off with this is, as a patient, if I look at something like a stroke, I mean, a friend who's a doctor who's
Mm.
also got MS, we were talking about this, and they said, well, essentially, the first 4 hours, because they're talking about preventing irreversible disability when you have a stroke. And it happened to be 4 hours was the number that stuck in my head. Now, I know MS doesn't need to be 4 hours, but are people thinking about an optimum time, like uh, uh, 12 hours, 24 hours, 1 week, 4 weeks? Is there some sort of ideal nirvana that, people would be treated
Yeah, so
by?
we can share the link. I can share you the link to the research. I'm sure in
Yeah.
your comments like later.
Yeah.
But
Oh,
um,
can I cut you off for a
yeah,
second,
sure.
Emily? By the way, folks, I will put all the links to everything in the show notes, in the description. So Emily's going to give me links. I'll put any links in. So, Emily, I apologize for jumping in there, but yeah, that was good. You reminded me.
No
Thank you.
problem at all, Dominic. Yeah, so the research that I just mentioned previously, the consensus research that we did, so when we spoke to different experts around the globe about what the timing should be, we can put the link to that in the chat as well for you. So
Uh-huh.
essentially, that paper has, and it had a nice figure which we can share as well, which had lists all the different timings. So there were things like, for example, um, once someone has been diagnosed with MS, like how long should they expect to wait until they have a discussion with their MS team about the aims of treatment, for example? And then
Yeah.
the experts agreed that everybody, no matter where they are in the world, 4 weeks, yeah, should be the limit of time of the discussion. If you're in kind of
Yeah.
a country where you've got more resource, 2 weeks, and then in a sort of an aspirational level, 7 days would be really good to be able to have that discussion with an MS.
Sure. Yeah.
That's just one example, Dominic.
Well, yeah. No, Emily, I think that's really cool because, frankly, if I rocked up and they said, Dominic, bad news, you got cancer, the follow up conversation isn't, well, Dominic, we aim to do something about this in 4 weeks, but go home, and if you can feel the tumor under your skin, come back to hospital and let us know. I mean, but MS seems to get that kind of, as a patient said to me the other day, Emily, when they were diagnosed within the last 5 years, the neurologist said to them, oh, well, come back when you're falling over.
Oh, yeah, that's awful.
I know. And it's just like, and when you're falling over because you've had so much nerve damage, as you said, as we said at the beginning of this, it's
Mm,
irreversible, but it could have been prevented or mitigated.
yeah, absolutely.
That's
And I
the
think
thing.
that's why it's really
Yeah.
important as well for people to kind of understand this as well, so that you can speak and have those conversations with the MS team.
Yeah. I mean, I'm not sure all MS teams are as comfortable, shall we say, taking the 20-year view and then being able to translate that to the patient and say, look, we're talking about the importance of 20 years' time. I know it doesn't feel like it, but I have a 21-year-old daughter and she can't conceive of being 40. She's at that level when that's old people, and now, I mean, I sailed past that old person gate a long time ago, but it's, I get it, but it's hard, but I think that's the job of the healthcare professionals.
Definitely, absolutely, to take that longer look view. Because I guess when you're having those
Yeah.
conversations with people, you're thinking about the here and now quite often immediately, aren't you?
You're terrified, aren't you? You're terrified. You've lost sight of one eye, or you suddenly can't walk properly, or then by the time you've seen the doctor, you're thinking, crikey, I kind of feel okay now because it's up and down to start with, isn't it?
Yeah, absolutely. Yeah, so in terms of those timings, I mean that research was published in
Hmm.
2018. So again, see, it's
So
getting
6 years
a
ago.
bit older now. So I think in the discussions we're having with stakeholders around the update of the report, we'll be wanting to discuss those timings again and see whether, yeah, they need to be updated as well.
Wow. Well, I mean, Emily, I think we can agree that, I mean, we know the time, it always staggers me the amount of time. I mean, you're talking about the first report, well, that's 8 years old. Then you're talking about research that's 6 years ago. And it's kind of like we know this stuff, it's known, but oh gosh, trying to get it from sort of knowledge to action is very, very challenging, isn't it?
Absolutely. I mean, in terms of our approach to updating the report, as I said, we're starting this
Mm,
gathering broad insights from the community. Obviously, we'll have an author
mm,
group and we'll have wider working groups. So these will be people with different expertise in the key topics of the report. So people with expertise in economics, in talking about how MS actually the biology of MS. People that have
mm.
expertise around monitoring the disease and patient reported outcomes, and also about sort of more holistic management aspects about how it can maybe impact on comorbidities, cognition, mental health, those aspects. So we'll be
Yeah.
speaking to all of the different experts, as well as obviously, most importantly, people with lived experience as well.
If I was going to put my business hat on and be, I'm not sure harsh is the right word, but we know now that generally after an MS diagnosis, it takes about 10 years before you are unable to work. And if that can be extended, then the government is getting money from you and not just spending money on you, which, from a policy point of view, when you're in charge of the national purse, must be a good
Mm,
thing.
definitely. Yeah, and
The health economics, is that the right phrase for it? Is this a health economics thing where there's now people looking at this from a health economics point of view? And, you know, sort of how I feel, should we say? It's just, how much does this cost? Is it better to spend a lot of money on Emily now rather than spending a lot of it on her later when I'm probably not in power? With our government system, it's 5 years max, isn't
yeah,
it?
I mean that's absolutely right, Dominic. I mean that's a really important part of the report. So yeah, we would describe it as a sort of socio-economic burden of the disease. And it will be really important for us to gather, to look at the scientific literature and see what's been published out there. So we've got the sort of up to date evidence on that, and it's all of the, like we discussed earlier, like the hidden costs as well, about the fact that people maybe not be able to work, and what that could cost society as well. And it's really important in a policy report like that we have all of that information in there, so policymakers can see as well about the sort of wider implications of some of these policy changes that we'll be asking for.
We were talking earlier, and it stunned me. I think, and this is a number from, I think it was 2010. In the
Mm.
UK, MS costs the country 1.4 billion pounds a year, but they acknowledge in the paper that they are not really taking a fully accurate view. So that's a sort of minimum cost of the things that they can count really easily. So you're right. I mean, all these other costs. What if my wife can't go to work and has to look after me 2 days a week? It's just, and then she can't make as much money. The government does get as much tax. It's got a knock on, not far beyond me, the patient.
Yeah, definitely. And in the update of our report as well, we'll be also including the data for related disorders as well. So for NMOSD, neuromyelitis optica spectrum disorder.
Hmm.
And one of the key reasons there is obviously there are similar principles apply to bring about high quality care. So obviously time matters in those diseases as well, but also that we feel like we'll have a stronger case for policy change as well if you discuss these diseases as a group, and present the data around it, yeah, as a group.
Right. Okay. Emily, I really appreciate you taking the time to come on, because I know it's tricky in the sense that you haven't got MS and you're not a medic and you don't want to say anything like that and you're running the project. But I met you at Ectrims and I realized just how knowledgeable you are, which is why I invited you on to chat about it, because I just want people to know that this is a bigger thing and there's stuff being done. And yes, it's not super rapid, I guess. I'd like something to happen tomorrow, but that's just me. I'm impatient. But I'm really, really grateful that you came on. And I just wanted to say I will put it's the report, even the one that you say, what is it, 8 years
Yes.
old? It's called Brain Health, Time Matters in Multiple Sclerosis. And it's a PDF document, which I will just put the link up. So, because it's free, you don't have to buy it or anything. You can just read it about the whole report. And when's the new one coming out? Are you planning on it
Yes,
coming out?
so that's a really good point. Thank you, Dominic.
When?
So yeah, so we'll be developing the report in the beginning of next year, and we hope to launch the report at Ectrims in 2024. So that will be a journal publication, and we hope to have a launch event where we can invite key people, and yeah, make a big splash about what the recommendations are. And then I guess really the hard work then starts, where we need to really engage with key audiences and stakeholders that actually have the mandate to implement our recommendations in different countries, and hopefully get some traction and get these policy changes.
Yeah, I mean, that's it. You can write it all down and print the report, but to actually for him, there's a big difference in somebody nodding their head and saying, "Yeah, I think that's awful. I agree with you," and it actually happening. But here in a UK context, maybe you can pre-write an invitation for a man called Wes Streeting, who's the shadow health secretary, who's likely to be the main health secretary by the time Ekstrom's comes around next year, and I would love to be his host at Ekstrom's to present this report to him.
Amazing.
In my dream world.
Amazing, Dominic. And if I may just say one last thing.
Yeah.
As I mentioned, we're keen to get as many people's ideas and insights as possible. So if you have any thoughts,
And people
you
can
can
contribute,
contribute.
Emily. Can is there some sort of, should we say, public
Absolutely. I
portal?
mean, we can share our the team email address and perhaps in the chat. So if
Right.
you have any perspectives on what in the system hinders people living with MS to live their best possible lives, what changes are needed, we'd be really keen to hear from you.
Right. And this doesn't matter where in the world you
Right?
are. You can use the email in the show notes in the description that Emily's going to give me, and you can just write in and say, I think this, that, or the other should happen.
Absolutely. We'd be very grateful for
All
that.
right. That's
Thank
perfect.
you.
Hey, Emily, it's not a problem. It's my pleasure. And thank you very much for coming on the MS Guide. I
Brilliant.
appreciate
Well,
it.
thank you for having me.